no sudden death. What is sudden death?
The time is too short that you cannot the events that have happened.
पहले तो बेटा मैं हमेशा कहता हूँ कि जो वर्ड है ना उसको एक्सप्लेन कर दिया क्या.
कोई
Death occurring suddenly. Sudden death happening so suddenly that from the onset of symptoms till the death occurs, you cannot certify with certainty. आपके सामने बंदा हाथों से निकला जा रहा है. Symptoms are progressing so quickly that it arises a suspicion of foul play. क्या हुआ? What is happening? That you are unable to understand the chain of events. The symptoms are progressing so quickly that you cannot certify death with certainty. That is sudden death. Cause may be any. And why it is important? Because every sudden death arises a suspicion of foul play. So it has to be investigated. Whatever the cause, it is natural or unnatural, but we should investigate if it is occurring in suspicious circumstances. So by definition, it is sudden and unexpected death. And the symptoms follow so suddenly and rapidly that from the onset of symptoms till the death occurs, the cause of death cannot be certified with certainty and confidence by the registered medical practitioner who is attending, or even the person is not hospitalized, physician is not attending at any place. If the person dies suddenly, it arises a suspicion of foul play. If healthy person dies suddenly, cause may be natural, but it should be investigated. So sudden death, when occurs suddenly, they arises the suspicion of foul play, and because the type of death may disguise a secret homicide. Sometimes it may be under hidden homicide, hidden element of poisoning or any other mechanism, but it can be disguised. So all sudden death should be scrutinized and investigated, and the person should be subjected to autopsy. As we know that the determination of the exact cause of death is the most important objective according to legal framework, legal point of view. So what are the types of sudden death? Sudden death may be because of natural diseases, or if it is unnatural, accidental or criminal, homicide or suicide. So the causes remains the same as for the cause of death. But here the onset of symptoms is so quick and so rapid that's why it has to be distinct from routine death as a sudden death. So the causes of sudden death, as all natural diseases in the CNS, CVS, respiration or gastrointestinal tract. And statistically it is seen that 80 to 90% sudden deaths, they have been because of natural disease. And by system-wise investigation in cardiovascular system, the ischemic heart disease is the most important and the leading cause of sudden deaths. The vessel involved may be any anterior descending or the proximal part of the right coronary artery or the circumflex artery or the main trunk of the left. So artery may be any, but ischemic heart disease is the most important cause. Then hemorrhage from the vessel, and the hemorrhage from any vessel depends upon the viscera where it is happening and the size of the vessel, amount of the hemorrhage, because sometimes very little amount of blood in pericardial sac or in brain, it can put a tons of pressure. Like brain, the intracranial structures There, you must have studied in physiology that there is continuous production of cerebrospinal fluid. There is a circulation mechanism. Input and output is maintained. You cannot increase the volume. It is maintained. And whenever there is hemorrhage, few milliliters of blood will raise tons of intracranial pressure and press upon the brain. So the outcome of hemorrhage depends upon the area, the size of the vessel, the amount of the hemorrhage. Like pericardial sac and the cranial cavity, they are the classical example where the small amount of blood can put enormous pressure. Then the speed and extent of hemorrhage is important. So all these factors, they help us in determination of the fatal period. And this is another classical example of negative autopsy and sudden death. Vasovagal inhibition. Any condition of fright, pain can lead to cessation of heart, stoppage of heart, sudden stoppage of heart by vagus nerve excitation. Any interference with the area of vagus nerve, the solar plexus, the perineum, the genitalia, the side of the neck, it can lead to sudden stoppage of the heart. So inhibition of vagus nerve, vasovagal inhibition, is the classical example of negative autopsy. That you cannot find any pathology. There will be no cause detectable. So similarly, in sudden death, you cannot detect, the autopsy will remain negative, and this is another classical example of sudden death. Vagal inhibition. What do you mean by trigger zones? Sensitive zones of the vagus nerve, the solar plexus, the perineum, the genitalia, the testes, they are the trigger zones. And there will be no positive finding at autopsy and it goes negative. Similarly, in the CNS, the causes 17% of sudden death is because of the central nervous system, stroke, CVS, cardiovascular accident, hemorrhages in the brain. 17% of sudden death is because of hemorrhage in the brain. I do practice in the evening as general physician. People take so casually. Well, they are not concerned with the health. 10,000, 12,000, 20,000 का सूट ले लेंगे, but they will not spend a 200 rupees or 300 for the health. Blood pressure, ਉਹ ਜੀ ਜਦੋਂ ਚੈੱਕ ਕਰਾਣੇ ਵਧਿਆ ਹੁੰਦਾ, ਚੈੱਕ ਹੀ ਨਹੀਂ ਕਰਾਉਂਦੇ. ਸ਼ੂਗਰ, ਮੈਂ ਤੇ ਚੈੱਕ ਕਰਨੀ ਛੱਡ ਦਿੱਤੀ ਹੈ, ਜਦੋਂ ਚੈੱਕ ਕਰੋ ਵਧੀ ਹੁੰਦੀ. This is the attitude. But blood pressure is a silent killer. ਇਹ ਕੁਛ ਨਹੀਂ कहता. ਮੈਨੂੰ पता चल जाता जी सिर दर्द होती, ब्लड प्रेशर बढ़ गया. हेडेक में भी और कॉज हो सकती है, लो में भी हो जाएगी हेडेक, बट दिस इज द एटीट्यूड. So the hemorrhage can be extradural, subdural, subarachnoid, intracerebral, whatever. Similarly, the respiratory system, allergies, infections, tumors, embolisms. Similarly, in the gastrointestinal, most important is the hemorrhage from the ulcers, stomach ulcer, duodenal ulcer, and tumors of the stomach and the colon, or any other fulminant viral infection. And in the genital, in males, the problems or trauma to the testes, and the female, the ectopic pregnancy. The most common, that the pregnancy is within the fallopian tube and the tube ruptures and there is massive hemorrhage, because the uterine vessels, they are the direct branch of the abdominal aorta, or extensive hemorrhage. It is very serious condition. Then rupture of the ovarian cyst. In unnatural sudden death, that cause may be accidental, homicidal, suicidal, or poisoning. Same as we discussed the causes in the cause of death, same can cause sudden death because the poisoning can be acute, poisoning can be chronic. Acute mean acute exposure, sudden toxic dose. Single exposure can cause sudden death, whereas slow poisoning or subclinical or subtoxic dose with repeated attempts can delay that can lead to chronic poisoning. If you like my video, please subscribe to my channel and press the bell button to receive all the notifications. And my channel name is Dr. Javed Iqbal Khokhar, Lectures on Forensic Medicine.